Hi everyone. Today we will be discussing the scope of practice for a certified nursing assistant, otherwise known as a CNA. So you're thinking of becoming a CNA, a very timely and formidable topic. Baby boomers and all Americans are living longer, and our healthcare system is overused and understaffed. There are supply shortages across the board in all of the healthcare spaces and in all of the healthcare roles. In all healthcare sectors, there are opportunities for the CNA, and they are a necessity and they are abundant. The outlook for the CNAs is very strong as they work in all forms of healthcare and in almost every space: nursing homes, hospice care, hospitals, home care, assisted livings, and doctor's offices. So let's take a look at what a CNA is allowed to do. This is your scope of practice. Whatever the CNA is allowed to do, that is their scope of practice. It refers to the tasks that the CNA completes on a daily basis, according to the care plan. The scope of practice describes the who, what, where, when, why, and how of the CNA practice. And by the way, it has nothing to do with a stethoscope. Qualities of a CNA. Are these qualities that you possess? Take a look at the qualities on the screen. We'll talk about a few of them. And if you can answer yes to these qualities, then you have what it takes to be a CNA. It's been said that patience is a virtue. Many times, patience is seen as the top skill of a CNA. The residents and clients and patients in the hospital are vulnerable and they're scared. Because of this, you may become the target of their aggression and their frustration. You must be patient. Your patients in the hospital, your residents in the clinic settings, your clients in the home, they're hurting. And your care and compassion carries a huge impact on their recovery. So compassion is seen as a necessary quality of a CNA. A strong sense of humor. You've all heard laughter is the best medicine. Laughing can manage or help to manage anxiety, tension, and stress. It's also been said that laughter can strengthen your immune system. So put on a smile and get ready to laugh if you're looking to be a CNA. CNAs must have a strong work ethic. This is important as we remember back to the dialogue of the shortage that is seen in healthcare nowadays. Staffing is almost always short. Your schedule can be very, very full and sometimes overly filled. So a strong work ethic is a large component of what makes up a CNA. Quick thinking can actually save lives. Being aware of your surroundings, being aware and noticing when patients are in need can actually help to save lives. As an example, let's say you're going to one of your patient's rooms and you pass by another patient's room and you notice something odd is going on in that other patient's room. A quick thinker will go in and assess the situation to see exactly what is going on. That quick thinker may end up saving the life of that resident. So let's move on and talk about a day in the life of a CNA. CNAs often work, as we said, in inpatient hospital settings, but they are more commonly found in long-term care residential facilities, rehab centers, and adult daycare centers. Their nursing assistants are involved in direct patient care. They assist doctors and nurses, as well as other healthcare providers with various treatments, procedures, and tests. Let's take a look at what a day in the life of a CNA looks like.
My name's Amber Wethington. I work at the Masonic Home in Shelbyville. I've always wanted to do nursing ever since I was a young girl. I've always had the passion to help others and make a difference in someone's life. Really, that's why I chose nursing. I just love coming in here and taking care of my neighbors, providing the care that they need and the support that the family needs. It's just what I love to do. My first day as a CNA was overwhelming. It can be very stressful and physically and mentally hard, because you're transferring patients from the bed to the wheelchair. That can be physically hard on your body. Changing patients, that's not for people with weak stomachs. So it was very challenging, but it was something that I loved, so it came easy to me. Day in the life of a CNA, you get everybody up for breakfast and make sure their hair is combed and their teeth are brushed or dentures. Make sure that they're dressed and we feed them. Then they have activities for the day that they do. During the morning time, we have exercises with them. Helps their mobility. They do it for about 30 minutes or so. They love doing it. They enjoy it. They have music that plays along with the exercises they do. And some of our Alzheimer's patients go back there and they do activities with them, paint fingernails, color, paint, just do different little activities, go to supper, and then they're pretty much ready for bed after that. It's always patient care first. So it's totally different than when, you're in school and you're just learning how to provide these things for the neighbors. When you get in here and you actually do it, it's totally different. It makes it okay for me because I know that they need me, and I can always put myself second when it comes to my neighbors. I want to grow in my career and do as much as I can and become a better nurse. And I had heard that you learn a lot in this position, So I was like, I'm going to do it, I was a CNA for 5.5 years. And then I went back to school for my LPN, and I've been an LPN for 14 months. Masonic Home always supports you. They offer LPN classes, RN school, so they really do support you. A good thing to know is it can be very tough and stressful and physical on your body. But if it's something that you're passionate about and something that you love, it is always going to be worth it at the end of the day.
Okay, so that was a short little video about a day in the life of a CNA. And other than the mispronunciation of Alzheimer's, I thought it was a great little video. So let's talk a little bit more about with whom you would be working. So a CNA does work independently. Usually a CNA is working with one-on-one with a resident or a patient. And sometimes they work with the patient and the patient's family. But the larger scope is you are part of a team. So conflicts do occur. They do occur between the staff and the patients, and they occur amongst the staff. Regardless of with whom the conflicts occur, you must remain professional. It's not okay to carry on and shout and insult and use profanity or demeaning behavior. You need to listen to your patients. They are part of your team, and they have the right to direct their care. They have the right to say what they want to do and what they don't want to do. That is in the patient's rights. So you cannot force a patient to do anything. And remember that you are working according to a care plan, and the care plan will direct what skills will be performed. It keeps everybody on the team within their individual scope of practice. So let's take a look at the CNA scope of practice categories. There's a few here: personal care, safety, basic nursing skills, infection, communication, cognitively impaired and mental health, basic restorative care, and residential rights. We can delve a little bit further into these categories and break them down a little bit. Basic nursing skills, vital signs, abnormalities in the bodily systems or functions, personal care such as skin care, bathing, grooming, proper feeding techniques, mental health and social service needs, and care of the cognitively impaired residents, infection control and understanding the chain of infection and following infection control, communication, not only being able to speak, but being able to listen and actively listen, understanding that you put out nonverbal cues with your body language and how that is seen by others. And finally, do you have charisma? Are you a charismatic person? Basic restorative services, transferring, ambulation, using those devices to help, providing privacy and maintenance of confidentiality. Confidentiality is huge in healthcare. We've all heard of HIPAA. Providing that privacy and the maintenance of the confidentiality is quite a large category. And then finally, promoting patients' rights, remembering that patients have an overall right to direct and be a part of their healthcare team. So this has been an informative understanding of the scope of practice of a CNA. If you have seen yourself in any of these discussions or any of the slides that we've talked about here, then you are probably ready to delve in to the world of a certified nursing assistant. Thank you all.